This video will cover the upper extremities, so your arm, which includes your humerus, and your forearm, which includes the radius and the ulna. So here we have the humerus, and now there's a couple of things I want you to be able to identify on the humerus. So here we have the head of the humerus, and that's going to be articulating with the glenoid fossa of the scapula. On the lateral border of the head, we have what's called the greater tubercle, and then here we have the lesser tubercle. More importantly are these structures down at the distal ends of the humerus. So on the lateral border, if you follow that down, on the distal end we have what's called the capitulum. So we know that it's lateral because if we look, the head will always be medial. So if we look at the opposite end, at the lateral part, that's going to be your capitulum. And that is the structure that will articulate with the head of the radius. Then we have, if we follow the head down medially, we find our trochlea. So the trochlea is the structure that's going to articulate with the ulna. Then down here, another good reference point is what's called your medial epicondyle. And so this one is one that you can actually feel on the medial surface of your arm at the elbow. So there's your medial epicondyle, your trochlea, capitulum, greater tubercle, and lesser tubercle, and then the head of the humerus. Now this is an anterior viewpoint, so we know that this has to be the right arm, because if this is medial, it'd be going into the scapula this way. That makes this the right arm. And the way that you can tell anterior from posterior is by finding the Olecranon Fossa. So here's the Olecranon Fossa, and that's where the olecranon process of the ulna bone, so here we see this, the U shape, so U for ulna, that's where that's going to connect into. So you can see the olecranon process connects into the Olecranon Fossa, and that's the bony part that we consider our elbow. So that's how you know the Olecranon Fossa will always be on the posterior part of the humerus, so that will be able to orient you that this is going to be the anterior, and because the head of the humerus is pointing this way, we know it's going to be the right humerus. So those are all the structures that you'll need to know for the humerus. Then if we move on to our radius and our ulna, which are the two bones in our forearm, we'll start with the radius. So the radius has a hammerhead-like head. So the head of the radius kind of looks like a hammerhead here. And so that's how you'll be able to identify the radius. On the anterior part of the radius, we have what's called the radial tuberosity. And so that's how one determining feature of how you know you're looking at anterior versus posterior. So if we look at the radius by itself, here you can see that hammerhead-like head, and then we know we're looking at the anterior here based off the radial tuberosity. Then to determine between left and right, we have to look at the styloid process. So the radius is the bone that's going to be found on the lateral side of your arm. So that's going to be going along with your pinky. So if we see that the styloid process, we know that it's going to be on the lateral side. That makes this your left radius, because this would be your left arm, and if you had it turned over like this, that would make this out here, and then your styloid process would be facing that way, so out laterally. So again, head of the radius, which articulates with the capitulum of the humerus, the radial tuberosity, which is just this bump on the front, on the anterior side. And then you've got the styloid process that helps you determine between right or left radial bones. So now we'll look at the ulna. And the ulna has quite a few distinguishing features at the proximal end. As far as the distal end, there's really not much there. So we'll worry about the proximal end of the ulna. And you can see U for ulna, so when you turn it on its side, you can see a nice U shape here. The process that's sticking up right here, that's going to be your olecranon process. And as we saw before, that's going to fit inside the Olecranon fossa of the humerus. So this is the olecranon process of the ulna, and that will go into the Olecranon fossa of the humerus. We also have a couple other structures we need to know. So we'll look at the ulna by itself. So here you see the olecranon process. Here you see what's called the trochlear notch. So remember we said the trochlea of the humerus is what's going to attach or articulate with the ulna. So that means that the ulna has a trochlear notch where the trochlea is articulating. So you can see here you have your olecranon process, the trochlear notch, and then if you look on the lateral side, you'll find the radial notch. So it's lateral because we know that the radius is going to be lateral to the ulna. So that's how we know this must be the lateral side, and again, this is going to be our left arm. So this is our left ulna. So that will be your radial notch, your trochlear notch, and your olecranon process. And that's as much as you need to know about the ulna. So quickly I wanted to show you how the olecranon process is kind of folding into this olecranon fossa on the humerus. So you can see when your arm is extending, the olecranon process will fold into the olecranon fossa and prevent that hyperextension. And then up at the front you can also see the attachment site here. So here you can see the capitulum, which will articulate with your radius, so the head of the radius. And then you can see the trochlea here articulating at the trochlear notch of the ulna. Then we have our hands. So the hands are consist of the carpals, the metacarpals, and the phalanges. So the carpals are these small bones down here that make up the wrist. Your metacarpals are the ones that are going to make up your hand, the dorsum of your hand. And then we have the phalanges, which there's 3 of them in the fingers and 2 of them in the thumb. We have the proximal phalange, middle phalange, and the distal phalange. Then we have in the thumb just 2, so that means we have the proximal and the distal. No middle in the thumb.